Are you wondering how we make the diagnosis of Sjogren's? What are the types of tests or antibodies that we are using? What are the criteria that we use to diagnose people? And is it possible to have Sjogren's disease if the antibodies are negative? In this video, I will answer all these questions in detail, so stay until the end to learn more about Sjogren's disease.
Rheumatologist OnCall.com.
Hi, I'm Dr. Girnita, a board-certified rheumatologist and an autoimmune expert. If you watch my channel, you know that I have many videos about Sjogren's disease that actually have millions of views, and I want to thank you for that. In this video, I will continue to answer some of the frequent questions from the people that are watching my channel. The first question is, what are the antibodies used to diagnose Sjogren's disease? The most common antibodies that we see positive in patients with Sjogren's disease are positive NA or anti-nuclear antibodies, positive SSA or SSB, positive rheumatoid factor, and even more rarely, we do see positive anti-centromere antibodies. These are a type of antibodies that we see more frequent in patients with limited forms of systemic sclerosis. And even more rarely, we do see people that will have positive anti-CCP antibodies. This is another type of antibodies that we see frequently in patients with rheumatoid arthritis. Now, in patients with nervous system manifestations like transverse myelitis, we also see a specific type of antibody called anti-aquaporin 4. Now, let me explain you deeper. Positive NA antibodies can also have a specific pattern, which we call speckled, and that will make us think about Sjogren's disease in certain patients where we have clinical symptoms that are suggestive of this disease. Now, based on this study that was just published this year in May 2024, the higher the titer of the NA or SSA and SSB, the more inflammation and a higher risk to develop organ damage you will have. If you want to learn more about the signs and symptoms of this disease, watch this video in my channel. However, you should know that there are also patients that are ANA negative, but they do test positive for SSA and SSB antibodies. So if you have dryness of the eyes, dryness of the mouth, or other symptoms, your doctor should order all of these three tests, ANA, SSA, and SSB. 60 to 80% of patients with Sjogren's disease have one or both SSA and SSB antibodies present, and when they are both present, there is always an increased risk for a more severe disease. Now, anti-centromere antibodies that I told you about can also be present in about 5% of patients with Sjogren's disease. There are some patients that will test positive for SSB but will not be positive for SSE. So what does it mean? Based on this study in 2015, the patients with SSB positive and negative SSA antibodies don't have a specific manifestation of the disease, don't have a worse or a better disease. A study published in 2017 showed that some patients with Sjogren have aquaporin antibodies, even in patients without neurological complaints. However, in the patients with neurological complaints like neuromyelitis optica, that they can have these antibodies, aquaporin 4 antibodies, those antibodies are specific for this disease. Now let's talk a little bit about the early Sjogren panel, because this test will raise a lot of debate in our rheumatologist world. This test will include certain antibodies from tissue proteins from the parotid of a mouse model, and these novel types of antibodies have not been validated as markers for early Sjogren disease because apparently they do not have human similar proteins in the parotid glands. So that's why there is need for further research to determine if this test is good to be used or not. What are the tests that are used to diagnose people with Sjogren's disease? Other laboratory tests are obtained very frequently along with the antibodies, like a CBC that is looking for signs of anemia, low white blood cells, low platelets, markers of inflammation like SED rate can also be elevated. We also obtain serum electrophoresis, complement levels. We also test for hepatitis B, C, TB, and HIV because we want to rule out potential causes for symptoms that look like Sjogren but is not actually Sjogren. We also use other types of tests, for example, tests to quantify the dry mouth, and a common test that we use is a salivary gland scintigraphy, and this test will give you the dynamic picture of how well the major salivary glands are working, and it is particularly useful for diagnosing Sjogren disease because a very low uptake will indicate a high likelihood for having this disease. We also use tests that will measure the saliva production rate. The unstimulated whole salivary flow rate is a simple test that measures how much saliva you produce. If after 5 or 10 minutes you just collect 0.1 milliliters per minute, then that means that the salivary glands are not functioning properly. Especially when you chew or when you take certain medication, that should trigger saliva production. But if you don't produce enough, that will qualify you as having dry mouth. There are also tests for dry eyes, and we can quantify how much dryness you have in the eyes. A very common test is called the Schirmer test, which will measure your tear production by placing a strip of a filter paper on the lower eyelid for 5 minutes, and you will see how much that will get wet. If it's less than 5 millimeters, it means that you don't have enough tears, and that is a sign of Sjogren's disease. Now, there is also a test where they can stain the cornea, this upper part of your eyes. It's called the Rose-Bengal test. If you have certain changes, that again will qualify you for dryness, and that will indicate that it's probably related to Sjogren's disease. Now let's talk about the salivary gland biopsy. A salivary gland biopsy is an important tool to diagnose Sjogren's disease, especially when other signs of autoimmunity are absent. The biopsy is usually taken from a normal-looking part of the lower lip and should contain at least 4 lobules of salivary gland tissue for a reliable evaluation. Now, the key feature to look for in this salivary gland biopsy is the focal lymphocytic cyaloadenitis, which means that they will look for a cluster of lymphocytes which are gathered together around the salivary gland ducts. This pattern is common in patients with Sjogren, but unfortunately it can be seen in other conditions and even in healthy adults. A positive salivary gland biopsy showing a focal lymphocytic cyaloadenitis with a focus score more than 1 is found in around 66% to 89% of patients diagnosed with Sjogren's disease. This means that this test is sensitive and it will catch about 80% of patients with Sjogren, but 20% will not. What are the diagnostic criteria used to diagnose Sjogren's disease? In 2016, the American College of Rheumatology and the European Fellows in Rheumatology, they joined and they came up again with a new set of criteria for primary Sjogren's disease. Based on a set of points for different diagnostic criteria, we can establish today a diagnosis. As you can see in this table, if you have a positive salivary biopsy or a positive SSA antibody, you will get 3 points for each. All of the other criteria, like ocular test, salivary test, they only get 1 point. And people are classified as having Sjogren's disease if you have a score greater or equal with 4. Can you have Sjogren's disease without positive antibodies? Now, let me clarify this question that many patients and many people watching my channel will ask. Can you have Sjogren's disease without positive antibodies? And as you can see in the ACR criteria from 2016, yes, you can have Sjogren's disease without positive antibodies. In fact, there are other studies that will show that. In a 2021 study, it was found that about 8% of patients with Sjogren's disease have negative SSA, negative SSB, negative rheumatoid factor, but they do have a positive ANA test. And 4.5% of patients with Sjogren's disease are actually negative for everything, negative for SSA, SSB, rheumatoid factor, and ANA. And now the question is there a difference between those patients that have the antibodies positive and patients that they have the antibodies negative? And accordingly to this study, very recent study from 2023 that included about 900 patients with Sjogren's disease, 32% were negative for SSA and SSB antibodies. And when they compare the patients with positive tests, meaning positive SSA or SSB antibodies, to patients that were seronegative, meaning that they were not having positive SSA or SSB, they have seen that more males than females, 90% of males and 76% of females, will actually be negative. And those patients that had negative tests, they also had more positive Schirmer tests and more interstitial lung disease. And I think this is important to remember because many males are rarely diagnosed with this disease, and their diagnosis is so much more challenging. And now that you have learned more about the Sjogren's disease test, you should watch this video to understand even more what is this complex disease about and how it can affect your nervous system.
Rheumatologist OnCall.com.